Thank you for joining us today for our discussion on innovative approaches to school-based suicide prevention. My name is Brian Nito, and I'll be your moderator today. I'm excited to be joined by a panel of mental health experts from around the country who will be sharing their insights and experiences from the field. With the start of the 2017-2018 school year, the CDC documented a rise in the rates of youth suicide. The data urgently calls for school districts and their partners in mental and public health to find new and more effective ways of engaging school communities to ensure that troubled students are identified early and connected to care. So during today's panel discussion, school district leaders from Virginia, Maryland, Ohio, and Texas will talk about using a new approach to suicide prevention, Kognito's online simulations. Panelists will share insights about developing consensus with school boards, administrators, and parents to introduce an innovative tool like Kognito into their district, successful implementation strategies, and best practices and lessons learned to help other districts as they begin the school year and their own respective journeys. Now, we've received a lot of questions from registrants on the call today, but one really stood out that really honed in on the general theme of today, and that is, how do we get teachers and administrators who see students most frequently to support our training around this issue of mental health? So we thank you for that question, and hopefully this webinar will explain a lot of what our leaders from across the country do on a daily basis. Now let us set some webinar ground rules. This presentation will be recorded. A copy of the recording will be sent after this presentation, and all attendees are in listen-only mode. But you have the opportunity to submit more questions on the right side of your screen in the chat box. Again, as I mentioned, we received many questions, so we'll try to get through the majority of this conversation so we can answer as many questions, time permitting. It's also worth noting that we'll be asking poll questions throughout this presentation to get a better idea about you and your school district. So let's share a little bit about who Kognito is. Kognito is a health simulation company that creates a suite of mental health simulations to train PK-12 educators, to students themselves, and around the topic, including how to approach students or peers showing signs of psychological distress and talk with them about seeking help. Through the power of virtual students, users build skills and see an increase in self-confidence to do so. Our PK-12 simulations have been used by over 300,000 educators nationwide and are currently available in 11,000 schools. These simulations are listed in the National Registry of Evidence-Based Programs and Practices, or NREP, and Kognito is the only health simulation company to be recognized by NREP. Now, within the simulations itself, educators will have interactive conversations with at-risk virtual students. The Kognito suite includes grade band level specific experiences. There are 3 in total: at risk for high school educators, at risk for middle school educators, and at risk for elementary school educators. Each of these simulations were created with the help of mental health experts and educators to address mental health topics common to students within those grade band levels that include cutting, drug use, bullying, home troubles, dealing with a family loss, a withdrawn student, and suicidal ideation. Now we're going to administer the first poll question. What is the size of your school district? So we'll get a better sense of who is out there in the audience. Are you a small, medium, large size school district, or very large? And you'll see that before they introduce themselves, you'll see that within our panelists, they vary in size and scope. Great. We'll keep that poll going, and we'll share out the results. It looks like 31% are small, so less than 100 teachers. It looks like 25% of are medium size, from 100 and 500 teachers as well. Great. Thanks for participating. Now, I wanted to go ahead and share a little bit about our panelists. We have 4 esteemed panelists who will be sharing information about their roles and their respective districts. Today we are joined by Amy Marchenko of Talawanda School District in Ohio, Marianne Panarelli of Fairfax County Public Schools in Virginia, Jennifer Lyon of Leander Independent School District in Texas, and Cindy Schulmeyer of Howard County Public School System in Maryland. I'm going to go ahead and turn over to Amy, who's going to share a little bit about herself and her district.
Thank you very much. As was mentioned, my name is Amy Masechko, and I have the privilege to serve as the Health and Wellness Coordinator for the Talawanda School District, which is located in Southwest Ohio. We are a small rural and suburban district, very large in geographic size, but I would say medium in terms of students, faculty, and staff, with around 3,100 students, 400 faculty and staff that all operate within 5 school buildings.
Great, thank you. I want to turn over to Mary Ann.
So this is Marianne Panarelli, and as was said, I work in Fairfax County Public Schools, which is a large, primarily suburban district near Washington, D.C. We have about 188,000 students and 200 schools. We have about 15,000 teachers, a little over 20,000 overall employed. And we're a pretty diverse school system. About 40% of our kids are white and 60% are from other ethnicities. We have about 190 languages represented in our school system, and about 30% of our kids receive free meals. So we're a pretty diverse group.
Thank you, Marianne. And let's hear from Jennifer from Texas.
Hi, I'm Jennifer Lyon. I'm the Coordinator of Counseling Services and Social Emotional Learning in Leander, Texas. Leander is a growing town just outside of Austin. Austin is the town you might have heard of. We are one of the fastest growing districts in the state of Texas. We have over 39,000 students, over 4,000 faculty and staff. We typically, for the last 10 years, have opened 1 new school each year. We're up to 42 campuses with 2 alternative schools. We have a low number of free and reduced lunch, probably about less than 19% for our district. So we're a pretty highly educated, high-income group of parents and students in our district.
Thanks, Jennifer. And last but not least, Cindy Schulmeyer from Maryland.
Hi, good afternoon, everybody. This is Cindy Schulmeyer, and I'm the coordinator for school psychology, as well as the chairperson of our mental health task force. We are a in Maryland, we are actually a medium-sized district. You can see we're almost 56,000 students. We are located halfway between Baltimore and Washington, D.C., so we have many families that one parent will work in Baltimore and the other parent will work in D.C. We are also a highly educated community as well. However, we are very much a changing community. We are now a majority-minority community, and we are certainly have been seeing our farms population increasing as each year goes by.
Great, thank you, Cindy. We look forward to hearing from each and every one of you throughout today's discussion. I wanted to take the opportunity, though, to highlight the topics that will be covered. The first being what factored in deciding to use Kognito. Second, how the panelists developed stakeholder buy-in and disseminated district-wide. The third, any potential barriers they experienced and how they were able to overcome them. The fourth, their district implementation pathway and chosen rollout strategies. And lastly, if they were to look back, what lessons learned and recommendations to those on the webinar today. So let's shift gears to the first topic. The first topic I posed to the group is what factored into the decision to utilize Kognito within your school district. And we'll begin with Mary Ann.
Yes, so we had seen a demonstration of Kognito about 6 years ago at a conference and had identified it as a possible tool to use, but were unable to identify a funding source. From that time going forward, we began to see an increasing number of students on our youth survey who were indicating depressive symptoms, thoughts of suicide, and so some urgency began to build around the topic. And then unfortunately in 2013 and 2014 we did see an increase in teen suicides within our community, which then brought it to the attention of our school board, our board of supervisors, parents, and being outside Washington, we have a pretty politically connected group of parents. So before we knew it, we had NIH and various people suggesting different things that we might use. With that kind of momentum, our county partners, our Community Services Board, which is the mental health group in our county, had the opportunity to get a grant that would fund the Kognito program on an open license so that anybody within Fairfax County, parents, teachers, schools, county employees, anyone could use the program. And so at that point we went ahead and started in 2 schools, and then with the success from those 2 schools ended up making it mandatory across our system.
Great. Thank you for sharing that. Let's hear from Amy.
Yes, thank you. Our community was first introduced to Kognito through Miami University, which is located here in Oxford, Ohio. And I have the privilege to chair our community-wide mental health work group as well. And so my knowledge of Kognito came through one of our members who mentioned that it was working really well on campus and we might want to share with the K-12 population. So we set up a call with the staff at Kognito to better understand what would be available to the school systems here in Ohio. And I have to say, when I logged in myself to go through the simulation, I was immediately hooked. I realized that this was not like any other online training. It's very unique, engaging. I appreciate the immediate feedback it gives you as you're having these critical conversations with young people. But at the top of it, as was mentioned earlier, we really understood that our staff was crying out for more resources, more training. They wanted to feel more equipped to handle mental health concerns that they were seeing among their students. I truly believe that, people involved in the school system get into the profession because they care about young people, but they are not trained or have the credentials in counseling, social work, or psychology. So they want to help, but are unsure about how and what their role is within the district when it comes to mental health. So we found that this tool would greatly serve our need.
Thank you so much, Amy. Let's hear a little bit from Jennifer.
So in the state of Texas several years ago, we had House Bill 2186 passed, which mandated that districts would do suicide prevention training and awareness for all staff. We have a wonderful team of social workers in our district called our Family Services Team. And so they vetted many programs and found that Kognito best met our district goals and our unique needs of our large district. So that law requires that all instructional staff in the state of Texas have this training. And in our district, we also have board goals that focus on the whole child. And so this really meets our need of how can we reach out and ensure that we are looking at the whole child every day in the classroom, not just their academics, but their social emotional well-being as well. So that really met a lot of needs for us.
Great. And let's hear lastly from Cynthia, or Cindy.
That's fine. So the story in Howard County has some similarities to the story in Fairfax County. We too experienced a year where we had more students die by suicide than we had previously. And subsequent to that year, which was 2011-2012, we formed a countywide task force to really study the issue more carefully. It's a result of that task force that I became introduced to the University of Maryland Center for School Mental Health, who was able to secure a grant for all statewide educators, so not just my district, but the entire state of Maryland, to be able to participate in this training at no cost. That, of course, helped the momentum, and when I went to my Board of Education and suggested that this be an opportunity to provide teachers with some additional tools, captured many of the things that the previous panelists had said, such as, how it engages an individual taking the training, how you can do it at your own pace, and things like that. And they too found themselves hooked. And in our district, the language that our Board of Education uses is that they are recommending it for all staff. I'm happy to say with that recommendation, to date, I have 79% of all of my staff that have taken the training.
That's fantastic. I think you're spot on, and I know that leads into the next question, but I just wanted to summarize this first topic is that it sounds like we have a variety of reasons why folks looked to Kognito, both legislatively or through community partners, or with, unfortunately, some increase in their respective school districts' suicide. So we thank you for sharing your stories, but it looks like, Cindy, you're up next to talk about kind of the successes and how you rolled into Kognito into your schools, both district-wide, and we want to learn how you got that 79%.
Sure. For us and for many of us who had an opportunity to participate in the Kognito training the first time, someone else used the word that, they found themselves hooked. And I think we found many of our staff who were taking it feeling the same way. And I think what is hooking people is a couple things. One, it is not stand and deliver. They're not having to listen to me or any of my colleagues stand up in front of them, but it's very personalized. It's very individualized. The staff person works at their own speed. They can stop and start it. We always share with our staff that this is a very difficult topic. Please don't feel like you have to do it all in one sitting. And so we really try and recognize, not only the importance of the topic, but the emotional impact of the topic. So that is certainly one of the things that has been very helpful for stakeholder buy-in. The other piece that's been helpful for stakeholder buy-in is actually students. I was fortunate enough to have some students on my task force, and they too found it to be intriguing. Now, many of them, I'll admit, were high school age students, so they were also starting to look at it through the lens of upcoming college students, of which Kognito also offers trainings for. And so they really also helped us sell the message about why making sure that we all know how to address students that we might be concerned about.
Great. And let's hear from Amy in Ohio.
Thank you. Yes, once I got all excited about the Kognito opportunity, I shared this resource with our district administrator, who oversees the counseling department and our student assistance program. And I asked if this simulation could be included on an upcoming agenda to share with the student assistance teams, who are made up of our counselors, our school psychologists, and administrators from each of our buildings. I think one of the key things that happened there is that we were able to provide them with a demonstration at the meeting, a short 5 to 10 minute portion of the simulation, to really help them understand. It's easy to talk about, but once they see it themselves, I again use the phrase, I think they were hooked. And we had 100% agreement at that meeting that this should be offered to staff members to address their desire to have the skills and the capacity to reach out to students in a more meaningful way. We also, as Cindy mentioned, recognize that this training, these topics, can be provide an emotional experience for staff members. So we thought it would be helpful to provide debriefing sessions throughout the time that we put the training out as a voluntary option to take, in case folks had feedback or wanted to better understand, once cases are referred to a school counselor, what happens after that? What is the protocol in our district? We offered this to our staff, and at that point, a very small number took us up on the opportunity to take it and to come to these debrief sessions. And I really feel like some of the barriers were, time, to find the time to fit it in, and the large number of online trainings that are required. So we know we needed to find the tools to address it and to make the time in order for that to happen. And so we have a required violence prevention and safety training here in the state of Ohio that all educators have to go through, and that provides the common foundation and language for us, but then these simulations provided the perfect follow-up opportunity where they could practice the skills learned, reinforce consistent messages from other trainings, and have the opportunity to come back at any point and brush up when they're faced with a situation. So that's kind of how we were able to develop stakeholder buy-in, and then our implementation plan will be discussed later.
Great. Thank you so much, Amy. And let's hear from a larger school district. It must have been very difficult for you, Marianne.
Well, we sort of took things in two steps. So we initially started, and we did make it mandatory from the beginning for 2 of our high schools to participate. We had already spoken to the principals at those high schools and knew from other interactions we had with them that there would be an interest on the part of their staffs in getting some information about how best to approach a child when the team was saying that they were in some level of distress. So it was not a hard sell to say, all right, we want everybody in your school to do this, because we need to get their feedback, and we're asking from the teachers to give us honest feedback about whether they think this is something that would be valuable to roll out system-wide. So those 2 schools participated in the spring of 2014, and the feedback was very positive. Memorable feedback, people saying, I've been teaching for 12 years, I should have had this on day 1. Why are we doing this in the spring, and we should have done this in the fall? But no one saying, why do we have to do this? So with that feedback, we were able to then approach our superintendent's leadership team, tell them the results that we had gotten from the earlier schools, and explain that it was available for us to use for free. We were not sure how long a period of time that would be, and so we were recommending that they go ahead and make it mandatory for all teachers, all administrators, and all counselors. And again, there was real support. There had been a lot of support from the community to have some sort of intervention that we could say that all teachers have been trained in. And so the superintendent agreed to make it one of the mandatory requirements. And the other thing that we did was we have various advisory committees, a student health advisory committee, various advisory committees, and so we did presentations to those advisory committees as much as anything to try to get parents and other groups also using the simulation. And again, I think that just created, every time a school board member or one of the leadership team turned around, there was somebody who was saying to them, this is really good, are they going to make it mandatory? And so it made our task of trying to get it added to the list of things that were mandatory relatively easy.
You make it sound so easy, Marianne, but I'm sure there have been, and this is a nice segue into the next topic, there must be some barriers when you're facing these different stakeholder groups, from parents to superintendent level folks. What, if any, barriers did you see, and how did you deal with them as they came along?
Well, as others had mentioned, teachers have a tremendous number of required trainings, many of which are online, and there's sort of an expectation that we can do it online because then you won't have to come out of your school and you can do it on your own time, as if teachers have a ton of their own time left by the time they get done teaching. So we knew that it needed to be something that could sort of fit within a schedule that made sense, but also allowed the flexibility that we knew different people needed and what time they wanted to do things. So we came up with a plan basically that allowed the schools, the principals of the schools, to make a decision about any 3-week period that they wanted to utilize to say, this is when we're launching this program, this is what we're doing, any 3-week period in the first semester of school. And so we started that kickoff by having our psychologists, social workers, and counselors at that particular school introduce themselves to the faculty to make sure everybody knew who everyone was. Again, we have large schools, typically around 3,000 kids, so there's a lot of teachers and staff members in each school. And they introduced it. They introduced the program itself, but also what the protocols were in Fairfax County for responding should you, say, get a text from a kid at 10 o'clock on a Friday night, or should you be reading something, an essay or something the kid has written and you see something troubling. So we supplemented what they were about to learn and gave them a context for what they were about to learn. We told the teachers that they could have any time in the next 3 weeks to get it done. We always made sure that those 3 weeks overlapped with one of the teacher work days. Our biggest barrier was that those teacher work days were already scheduled a full year in advance in terms of the content, so we could not suddenly stop everybody else and say everybody has to do this on this day at 10 o'clock in the morning. So we had to leave the flexibility, but also leave that a teacher's teacher work day is not typically scheduled 100% of the time with a training, and so they would have some time if they chose to do it on that day. We found that most people had completed it well before they ever got to the teacher work day. We do not have unions, so we did not have to deal with a union kind of an issue. It was more a matter of saying sometime in the next 3 weeks, get this done. The other thing I would say is just that if we are going to make something mandatory, then we have to have a way to track whether people actually finished it. And for us, we have a system that tracks sort of on a transcript for each teacher what trainings they've completed. And so we needed to work with Kognito, and there was quite a few conversations back and forth between our IT people and Kognito about how we would get the sign-ins from Kognito to also include an FCPS employee ID, so that we were then able to take information from Kognito and upload it into our system. So there were barriers that just come up because you're a large system and you're trying to, as I said, if you say something's mandatory, then it's important to make sure that you're giving principals some feedback about whether their staff has in fact completed the training. So it took us a little while to get some of those processes in place, but ultimately we were able to do so.
Thank you, Marianne. Let's hear from Jennifer in Texas.
Well, similar to Mary Ann, we faced some of the same barriers. Obviously, teachers' time is very, very limited. And so when we rolled this out district-wide last year, we set aside a day in the fall, a staff development day, that we expected all teachers to do that. So they had a given designated time on their campus that day to complete the training. Since then, we are now just requiring all new to district staff to do that. So again, they do, that comes out with their compliance videos that they do at the beginning of the year. So they are very overwhelmed, I'm sure, with all of their video compliances that they must do. And because we are a large district and it is mandatory in the state of Texas, We also work on the compliance tracking, and that's where I've been working a lot on this year, is creating a process, working with our IT department and our HR department on developing the right kinds of reports to run, who are our new employees. They're in the state of Texas, they need to have done this training within 30 days of their hire date. So there's a lot of work up front at the beginning of the school year, but then less and less as the months go on. One of the other barriers that we faced was last year, the state of Texas, because they passed this bill, funded the Kognito program for us, and then the funding went away like things often do. But because we had bought into this and we saw the value of it, we did have an increase in suicides in our district over the last several years, and in our county as well, and in our state. We are one of the lowest funded states for mental health services, and all that plays a big part in it. So the funding went away, but since we had seen so much value in how it educated our staff and how we really needed this program to serve them, then our district was able to say, yes, we value this, we want it, we're going to continue paying for it. And I hope that we are able to continue that going forward, because we are focusing a lot in our district on mental health awareness, prevention, and that kind of thing. But the big barriers, I think, always are going to be, when do you do it, how do you do it, and how do you pay for it? So we've kind of worked through most of those barriers.
It sounds like everyone has common barriers, and you all, both you and Mary Ann, thought very strategically and working across the aisle with allies, it seems like, to really move this forward. So we thank you all for your efforts. Thinking in that vein, topic number 4 looks at what your district implementation approach or rollout tactics. I know that some folks on the line are curious to know what that promotion or awareness, those tangible things, look like. So let's go ahead and see and hear from Amy in Ohio.
Thank you. As I previously shared, we kind of did a voluntary rollout initially, and found that the people that took the time to do it were very impressed and appreciated the opportunity and learned a great deal. But that was not the majority. And so our director of teaching and learning did go back to our district leadership team and asked that that Kognito could be integrated into this year's professional development calendar. While we also have dedicated days throughout the year for professional development, as was already stated, they usually are planned and have a topic already assigned to them. We do have the flexibility, however, of having early release time on Wednesdays in our district, where the students are released to go home and the teachers are there for professional development purposes. And so it was recommended that we roll it out in that way this coming year, and overwhelmingly the district leadership team said yes. The building principal said yes, we will find a Wednesday where we can make this happen, because they do see the great need. It even went so far as the leadership team recommending that we not just stop at our certified staff and faculty, but our classified staff, our educational assistants, our cafeteria workers. They need this very critical information and knowledge and skill training as well. And so we are going to utilize a day when they are scheduled to be there when students are not, to ensure that they have this training as well, because they definitely see students in very unique settings and situations, and very probable that they would need to engage in a conversation if they saw a student in distress. So we're excited to roll it out in that manner this fall, and we've kind of taken a layered approach where we're looking to provide our tools for our staff, and then realizing that we need to also support students in building skills and empowering them to reach out to their peers when they see that a friend or a peer is is in distress or in crisis. So we are very excited to begin to integrate the friend-to-friend simulation for high school students into our 9th grade health curriculum as well this year.
Great, thank you for sharing that. I know that a lot of the topics around professional development around educators, but we do have an offering for students that is embedded within the health curriculum. That's a recommendation. Let's hear from Jennifer in Texas about her tactics in rolling out.
So our district has been ahead of the game, I would say, as far as suicide prevention and awareness. Our counselors have a very detailed suicide risk assessment they do with students who come to their office with those outcries. So when we decided to implement Kognito, we started with three schools that had our highest outcries, where we call them SRAs, suicide risk assessments. And so we started with those 3 campuses because we knew that the faculty would buy in. So at faculty meetings, our counselors introduced the topic of Kognito and what it was for and why we were doing it. Then the staff were given time to go to their rooms and complete it on their own. And then counselors were available. We try to let the counselors know, or the counselors let the staff know that this does bring up, issues within yourself. And some people have a very difficult time hearing this topic because they may have personal experiences with it. So we made sure that our counselors are always on campus and available to staff as needed. And then we take it a step further and developed a face-to-face training that all of our counselors implemented last year after everyone completed Kognito. This year, we did the face-to-face training before the first week of school. So that's just basically a PowerPoint presentation that the counselors did with all faculty. How do we deal with this on our campus? Who do you come to for help? Never leave the child unescorted. What happens if a faculty member or a colleague is feeling suicidal? What is our district protocol if you hear of a student after hours? Similar types of things that Amy was saying. So we found that, having different components, Kognito was a wonderful tool, but we also wanted to have that face-to-face with our staff as well, because sometimes when you go through this training, it brings up things for you as a teacher or an educator that you just need to make sure that you have someone there for you. Having also said that, we found that one of the benefits to Kognito was really helped with creating some appropriate boundaries for some of our teachers who are very well-meaning and get very deep into the lives of their students. But through those simulations, they realize maybe this is a problem I need to take to somebody else because I really am not qualified to handle this. And so great conversations came up on many of our campuses around that boundary issue, and we found that to be very, very helpful in addressing as well.
Thank you for calling that out. I think that's one of the things we want to promote is that you all on the line and our panelists today are the trained experts and educators. Even though that they interact with students on a daily basis, they're there to refer them to the appropriate supportive. Their eyes and ears have to be open at all times, and perhaps that is their opportunity to take it all in, but refer them to folks like you all on the line. So let's go ahead and hear from Cindy.
Sure. One of the things that I'm learning as I'm listening to my colleagues is that we have each created a rollout plan that fits the context of our system. So some of what I'm going to share is little pieces of things that were shared by others, and then just sort of set to fit what we need here in Howard County. And the approach that I took is that the first winter and spring that we became familiar with Kognito, I started by having opportunities to stand before my colleagues in student services, which is school psychologists, school counselors, alternative educators, school nurses, and people personnel workers, and actually provided them with real-time training and had them actually take the training while I was present with the large group. We then used that as an opportunity to debrief afterwards, and I did that debriefing with each of those audiences. I did the same thing with smaller groups of school administrators. I wasn't able to get all of them in the room at the same time, but certainly had opportunities to meet with smaller groups. it was really a result of those different trainings with individuals who, do this work that I was able to gather some common themes and some common questions. And really the goal behind having all of them participate in the training was to make them aware of what the Kognito training was, so that when we were ready to move into the schools and have the teachers participate in it, not only were these staff available to support their colleagues, but they were also available to have continued follow-up conversations. And so you would often hear about people talking about Renee in the high school scenario, or you would hear people talking about some of the other students that are depicted in the various trainings. And along those same lines, in preparation for the rollout to all of the schools, and I have 76 schools, we also provided a frequently asked questions document that was provided to every single teacher. And some of it was technical, how do you get onto the training, how do you do it, can you start and stop? But also some of it was an opportunity to reinforce our already existing procedures that we use when the students make suicidal statements, and telling them about how to, essentially reminding them how to make their referrals when they're hearing students making those statements, or they read the story and, or they hear a song lyric or something where a student is either feeling distressed and or actually making actual statements of self-harm. The final thing that we did in our district was we offered a little bit larger of a window than what I've heard some other folks describe, but the approach was the same, where we provided a variety of opportunities for teachers to participate. So whether it was in a professional development day, whether it was during a staff meeting in the school, whether it was during other planning times that teachers have, while we provided them with a block of time, we also provided them different opportunities to take it, and therefore they weren't, in our situation, we weren't having everybody take it at the same time. It was a little bit more self-paced.
Thank you. Thank you so much for sharing that, Cindy. Now we're going to jump to the final topic, and I want to be respectful of everyone's time on the call. So we'll recommend about 1 to 2 minutes each on sharing some of your best practices that you've learned from your district implementation. So if you were to take a look back, what would you tell yourself when you first started with Kognito? And we'll start with Mary Ann.
Okay. I think that probably the two main things that we learned was that there was great benefit in doing the introductory experience as a faculty as a whole and sort of explaining to them what to expect. And I did not mention it, but we also set up at the end of those 3 weeks debriefing sessions if people wanted to participate in those. That part was voluntary. The other thing that I would suggest is that people who are using Kognito might want to reach out to the company to get the results of your pre and post survey. The teachers take a pre and a post survey, and we found it very useful to use that data to make the argument that going forward we should have some funding from the school system because the grant that we originally had is no longer in effect. And so being able to have hard data about what the impact of this training was really helpful.
Thanks, Mary Ann. Let's hear from Amy.
I think the top 2 lessons that we learned are first that providing dedicated time for this is critical in order to not only ensure that it happens, but also, as my colleagues here have shared, provide the necessary opportunities to ask questions and debrief and just ensure that you have the proper supports available for your staff at that point. And secondly, for us, this has been best facilitated because the need has been established. Our staff have been asking for this type of training, this type of tool, and therefore it has been easy to sell in that regard because it is hopefully meeting the need that they have shared with us.
Thank you, Amy. And let's hear from Jennifer in Texas.
So I'm going to take a little bit of a different twist on this. I'm going to share a success story. Lesson learned is Kognito saves lives. I was a campus counselor several years ago when we first implemented this, and I had a student that I was seeing for pretty serious mental illness, and at one point before the winter break, she had gone to a psychiatric hospital, spent some time there. Then we had winter break. She came back to school. She was at school for 3 or 4 days, and we had just gone through this training in the fall. We had done the face-to-face follow-up that we developed probably in November. And so our teachers were well versed in this. And when my student came back from the psychiatric hospital, I gave enough information to teachers to know that she was at risk, but not so much to, upset her confidentiality. But there was a particular day, a Thursday after she had come back, that the first period teacher saw her on morning duty, when she was on morning duty, saw her come into the school building in the morning, but didn't come to first period. So about 5 to 10 minutes into first period, the teacher called the office. I'm missing this student. So then they radio me, and I knew exactly where she was because she had told me her plan for suicide. So I ran down to the bathroom where she had consumed a large number of, a lethal amount of pills. We were able to get her to the hospital, get her the care she needed. She's still alive today, 3 years later, which is a huge accomplishment for her. But the lesson learned is that Kognito and suicide prevention awareness save lives.
Wow, thank you for sharing that story. I think those are the things that we as individuals, as mental health leaders, need to hear from those on the field. And it's rare to hear that you all can make that connection from the experience of that individual teacher. So thank you so much, Jennifer, for your story. Let's go hear from Cindy, Cindy in Maryland.
I'll just add one more thing to the many things that everybody shared, and that is that while we are all aware that this program was designed as a suicide prevention tool, when I'm really talking with teachers, I'm really also talking about it that suicide prevention isn't the only thing I want to be aware of when a student is in distress. I just want to know that a student's in distress and let us figure out how we can help them. And so whether it is suicide or whether it is other situations that are going on in the student's life that they need some support, I think that's really where we as educators and we as mental health professionals need to step in. And if this program can help us do that, then it's worth, all of our time.
Here. Thank you so much for that story as well. I'm happy to say that we are right on time, and we have a number of questions from those listening in. Feel free to add to those questions in the chat box. And again, this is an open forum, so if you have a specific question for one of the panelists, please feel free to ask it with that individual's name. But to start, we received a lot of questions, general topics, and one of them is towards folks that are probably the least bucket of individuals that feel like they don't know how to address suicide prevention, and that's our school leaders, so your principals. And they have that initial barrier and least understanding to push something out like Kognito. So to the panelists, how do we get those principals on board? How do we make them understand that suicide prevention is important? And let's hear from Cindy. How did you try to swing some buy-in from some of your principals?
I'd say in my situation, I didn't have any challenges with probably a good half to two-thirds of the principals because they already believe that this is an important topic. For that last group of principals who were struggling to figure out where this fits into their work as school leaders, where this fits into the work of the educators in their building, really what I have found is when I talked just briefly before about talking about certainly suicide prevention is one thing that we gain from this program. The other thing we gain is we gain teachers hopefully increasing their comfort level and having difficult conversations with students. And if they don't, just like the training says, you know, if they identify approach, they can jump right over approach and go right to refer. But really, if we increase in our teacher skill sets, then that usually is what I was able to use as the reason that this would be invaluable, and administrators would often agree with that.
Great. Is there anyone else on the panel that would like to address their challenges with principals or school-based leaders?
I'd like to pipe in. This is Jennifer in Texas.
Go ahead, Jennifer.
Data. That's pretty much it. Principals are always looking at data. Data is a big focus. And if you can show the data of how this helps your students, how this helps your teachers, and what kind of prevention it does for them, how helping students social and emotionally allows them to be more focused on learning when they're at school. So if you can find the data in your district, the data is out there. You sometimes have to dig for it, but counselors can help find that data. Teachers can as well. Nurses can help find that data. How many visits to the nurse a student has is often a good indicator of something is going on with that child. So data is a great way to reach administrators and let them know, yes, there is a problem and we do need to address it.
That's a great call out. I think data speaks for itself. And when you see, I believe it was Marianne who spoke about pre and post surveys, just seeing the lessons learned or the mental health skills that they are required, the ability to show that, and also that what you just spoke of, the utilization of the actual product itself. Now we have a great question from an audience member, Erin. She asks, can anyone discuss any experience with cultural considerations or diversity through the lessons learned? So why don't we hear from folks, let's hear from Mary Ann at Fairfax.
So because our original rollout was to teachers, we did not hear a lot of feedback about the product not being enough culturally diverse, etc. We have been doing more right now with students with the friend-to-friend, and while that has not been so much of an issue, one of the issues that has come up is translation. It's just having it in multiple different languages. We have not solved that at this point, but that is an issue that we are beginning to face. And as I said at the beginning, while our second language to English is Spanish, we have over 190 languages, so it's not a simple, if we could just have it in Spanish, then everything would be great. In terms of the cultural approach, I think that there's a little bit more of that in the elementary program where you're talking about talking to parents. And again, as we do our precursor presentation, each school team tries to address issues that they think might come up if a teacher was trying to have a conversation with a parent who is of a different culture than the teacher is. So we weave that into our introductory lesson.
Great, thank you so much for that. And you bring up another bucket of folks that you potentially work with are those parents. So I wanted to get some feedback from Amy. Amy, what did it take to engage the parent community, and how did you help them or feel like you were supporting them, even beyond Kognito, just general parental buy-in?
Definitely. So our comprehensive health and wellness program in our district includes multiple strategies to reach out to parents and make sure that they feel that they have some tools to be able to help their children or the young people in their lives. And so while we have not rolled out Kognito per se to our parent population yet, there are some similar programs, one of which is with our the Prevention Action Alliance here in Ohio, which is called, and they've created called the KNOW program, KNOW, and every other week there are emails that we send out through our school newsletters and through other community outlets that share tips with parents about how to talk to your child about some very difficult or topics that parents may choose to stray from talking about because they just don't know how to do it. And these tips provide very practical, like bullet points into items that you could say, whether it's about substance abuse or it's about anxiety, depression, media literacy, whatever it may be. That has been a very effective tool for us in engaging our parent population.
Fantastic. Thank you so much for sharing that. I wanted to, there's a lot of questions coming through, one from Victoria about how you get approval and buy-in. So I think Jennifer spoke to it a little bit earlier. The specific question is, did anyone go through their school board or their teacher union for approval and buy-in? Jennifer, you want to kick this one off?
Sure. I think this program was in place before I took this position at the district level, but in Texas, because it is mandated that we have this type of training, I don't know that it went through our school board. I do think now if we were to take it away, there would be a fight for us to keep it from our school board and other members of our community. I think you have to look at what your state's requirements are. It does, like I said before, data doesn't lie, and it is helpful to pull that, and usually county officials can help you with that as well. So if you're looking for a funding source, very oftentimes, if you use that data to your advantage, you may be able to get that funding source.
Great, thank you so much. We have one more question. I want to be respectful of everyone's time, and I just want to pose it to everyone else in the, all the panelists. What additional resources do you use traditionally in the classroom to address mental health concerns? I know that this was very much a Kognito discussion about this innovative approach, but what other innovative approaches have you tried to utilize in the classroom as well? Let's hear from Marianne.
So we have woven mental health topics into counseling lessons that we do from kindergarten through 6th grade, and then in health lessons from 7th through 10th. So all students are getting a certain amount of information about their own wellness across the board, including mental wellness. I would say that's our most universally used approach.
Great. And how about Amy?
Our district has subscribed to the framework of the 40 developmental assets, which has strong research behind it from the Search Institute. And so across our district, K-12, embedded in curriculum, in counseling lessons, in overall positive behavior support initiatives throughout the building, we try to strategically work to build assets in our children, because we know the research is clear that the more assets our students have, the less likely they are to engage in risky or unsafe behaviors. And so we are very intentional about the use of that framework.
Thanks. And let's hear from Jennifer.
So we do many things in our district. We are currently in the process of rolling out Second Step, a social skills curriculum that we are using with all of our elementaries from kindergarten through 5th grade. Our counselors also do about approximately 1 lesson per month in all grades K through 8, and then some variations of that in high school. We have student groups called C Squared, which is a coalition of clubs. We have No Place for Hate. We focus a lot on caring and kindness as a culture in our district. We have several guiding documents in our district that focus on the whole child, and we have 10 ethical principles that we are teaching in our classrooms each month as well. So we do a lot of focusing on the whole child.
Great. And last but not least, Cindy.
Sure. So one thing I will add is that in Howard County, kindergarten through 9th grade, all students take a health education class. And I know this is a strategy that is used with many, many other districts, but it is in that health education curriculum that we will embed mental health topics. We will embed resiliency building topics to support the students. I will say an area that we wish we could figure out a way to address is our 10th, 11th, and 12th graders. And that is a current topic under study with the Mental Health Task Force to try and figure out how we can provide students in those ages with some additional support under the mental health topics.
Great, and again, I know some folks have plugged it already, but there is the high school curriculum called Friend to Friend. And I wanted to be, we're at the top of the hour, and I wanted to just acknowledge and thank our panelists for joining in the webinar today to discuss this important topic of supporting students in their well-being and the innovative approaches that they all take. If you want to learn more about the conversations that we just discussed, please visit Kognito.com to learn more details on all of our PK-12 offerings, which also includes and references recorded webinars such as this, which will be posted in the next day, but also a great discussion with Scott Poland on the topic of suicide prevention. Thank you all again, and we hope you come back to our next Kognito webinar. Have a great day.